Thank you for your patience and cooperation as we bonded your braces. I will now explain more about your braces and how to take care of them. The metal piece attached to each tooth is called a bracket. Brackets are designed to fit the specific shape of each tooth, allowing orthodontists to put the necessary pressure on the teeth to move them. When necessary for someone's treatment, bands are used on the molar teeth. The wires that go around your teeth are called arch wires. Your orthodontist will change the type of wires as your treatment progresses. Properly secure and engage the arch wire on the brackets, little rubber rings called color ties are used. We change these color ties during your periodic visits, usually every 4 weeks. Now, I will explain how to properly take care of your teeth and gums. Since your orthodontist only observes the movement of your teeth, you still need to visit your general dentist every 6 months for cleanings and checkups. Cleanings are still possible with your braces, and most cavity filling procedures can be done as well. Maintaining proper oral hygiene on a daily basis is the best method to prevent cavities and gum inflammation. If the teeth and gums are not properly cleaned, the gums will swell, which can result in the weakening of the supporting bone. The plaque that builds up around the brackets releases acids, which cause your teeth to lose calcium and other minerals. When this happens, the surface of the teeth turns white and becomes more prone to cavities. These white stains are permanent, so it is very important to properly brush your teeth and gums to avoid this. Hold your toothbrush at a 45-degree angle and use short, circular strokes to clean each tooth and bracket. Sweep the toothbrush in the circular motion both above and below the arch wire, and remember to brush your gums as well. You should brush your teeth at least twice a day. Flossing is a very important step in keeping your gums healthy. The purpose of flossing is to scrape off bacteria in between your teeth and gums. Therefore, it is important to floss every day, even if you don't feel like any food is stuck between your teeth. This is an ortho pick. It is similar to other dental flossers, but one end is thinner, allowing it to perfectly fit behind the arch wire. Place the thinner tip behind the wire and push the flosser between your teeth. Make sure to scrape the sides of each tooth and slide the flosser in between the gums and the teeth. If your gums bleed while you are flossing, it is not because you flossed too deep, but because there's bacteria buildup and your gums became weak. So if you notice bleeding, it is important to continue flossing and allow the gums to bleed so that they can properly heal. This is Super Floss, another flossing option for people with braces. The tip is made with a stiff plastic, which makes it easier to pass the floss under the wire. Tightly wind the floss around your middle fingers and use your index fingers and thumbs to control it, just as you would with regular floss. Tightly hug each side of the tooth with the floss and slide it down in between the gums and teeth to remove bacteria buildup. This is a proxy brush. It has a flexible tip which allows you to easily remove food particles stuck around your brackets or under the wire. You can slide the brush tip along each bracket and under the wire to properly clean those harder to reach spaces. The proxy brush can also be used to clean between teeth, so use it as a floss between teeth such as the molars if there is enough space. If the space between the teeth is tight though, don't force the proxy brush through as it can damage your gums. Broken brackets can delay and complicate the treatment process, so you should avoid consuming hard and chewy foods while wearing braces. If you notice that a bracket comes loose or comes off completely, make sure to give us a call and bring the bracket with you to your appointment so that we can re-glue it to your tooth. When hard and chewy food bends the wire, it can move your teeth in the wrong direction, which complicates and delays your treatment process. Examples of hard, chewy foods to avoid include nuts, pretzels, carrot sticks, and various radish kimchis. You also shouldn't chew on ice. Biting into harder foods such as apples can also break brackets. Instead of biting into these harder foods such as apples, pears, meats, or harder breads, cut them up into smaller, bite-sized pieces. will take some time for you to get used to your braces. If the braces scratch the inside of your mouth, you can use wax to cover any areas that are poking you. Usually a pea-sized amount is enough to completely cover a bracket. Roll the wax to soften it, and then use your index finger and thumb to position the wax over the bracket and pinch it to properly secure the wax. You can eat with the wax on your brackets, and it is okay if you accidentally swallow it, as the wax is non-toxic. Just try to avoid swallowing too much of it, and make sure to replace the wax at least once every 2 days to keep the area clean. Braces start to hurt approximately 5 hours after we bond them. The soreness and pain will last for a few days. You will, however, start to feel a little bit better each day, and the pain usually only lasts for a few days to a week. You can take over-the-counter pain medicine to relieve the discomfort, and it is best to only eat soft foods in the beginning. You will notice slight soreness and discomfort in the days following your monthly visits as well, but the first week of braces will be the most uncomfortable period of the treatment. Congratulations on the start of your treatment. We ask for your cooperation throughout your treatment process, and we will do our best to keep the journey to your new smile as pleasant as possible.